Good morning, everyone, or good afternoon, good evening. I know we have people from around the world, actually, and I'm happy to welcome you to the nursing webinar sponsored by the International Society for Telemedicine and eHealth. I am Claudia Bartz, one of the co-chairs of the Telenursing working group. We have three presentations, actually. One I think will be presented by two different people, but we are going to try to stick closely to the times so that there's time at the end for discussion. And I would like to introduce the first speaker. Each speaker will tell a little bit about themselves, I assume, and then make their presentation. So we will have Pirkko Kouri from Finland. Each speaker will talk for about 15 minutes, and then at the end, we'll have about 15 minutes for questions and discussion. So, Pirkko? Are you muted? You are muted, Pirkko. Still muted.
Okay, now, I don't know, I was pressing the button, but maybe you okay. Unstop sharing, Claudia. You have to stop sharing.
Well,
I can see your slide, Claudia.
I'm trying to go back to full screen presenters and I'm having trouble.
Okay,
there we go.
Okay, now it's fine. Yeah, okay, now it's fine.
Okay.
So,
okay, sorry.
What is happening now?
Your slide is up.
Can you see them?
Yes.
Because I can't see them now. Wow, what happened here? I can't see my slides, so I can. What happened here now? Okay, I will try to. I can't see my slide now here. Something happened here. Fredrik, should I come there again? Because I can't see my slides.
Yes, try to stop sharing and then.
I can't see even the button now. I can see only your face.
Let me do that for you.
Okay, now I will try again. I don't know what happened, but I will try again. Share. Can you see now?
Yes.
Okay, thank you. Yes, and thank you for organizing, Claudia, this together with us, this meeting or webinar, and I will discuss about the Finland's telehealth strategy, which is built for nurses. And in Finland, we use digital health instead of telehealth and eHealth. I think the concepts are developing along how the society is changing. But as Claudia said, I'm the vice president of this society and vice chair like Claudia in this Telenursing working group, and I'm also board member and secretary of the Finnish society. Okay, now I'm trying to change the slide. It's nothing happens. Well, anyhow.
Yeah, Pirkko, if you go on the right in the sidebar, try.
Yeah, yes, that works. Yes. So I will discuss the content of a presentation that I'm discussing why it's important to be part of national development process. I think the nurses are the biggest group among healthcare professionals, and that's why it's crucial that our voice is heard when we are developing new systems, and we have to follow actively what is happening around and participate in issues concerning healthcare. And something about our working process, then I introduce strategy in brief because it's available on our website in English as well. And here you can, which is leading us, it's the change in society. And I'm happy that in Finland, the digital divide has been narrowing, but it still exists. And here you can see the statistics, which we do annually in Finland. So we follow the internet usage. And if you think 93% of Finnish age 16 to 89 years have used internet, and 82% have used internet several times per day. And also during the last 2 years, the instant messaging video calls, the use of them has grown a lot, and maybe it's due to the pandemic as well, because people are working remotely. And also we have this Corona app, which is to detect where you have got the disease. It was loaded, it was launched 2 years ago, and we have 5.5 million inhabitants in Finland, and 2.3 million were using the Corona app. So we accept widely these digital tools. And here you can see a national study. We did it from 2018 to 2021, and it is done in the healthcare centers, and it was estimated virtual meetings with or without the professionals. It was estimated monthly during those years, and the amount of real-time contacts grew a lot. So via phone, virtual transaction, real-time transactions with all professionals, and also those transactions without real-time contacts with professionals like emails, etc. And which I was very happy, because the nurses are the biggest group, and all the contacts which were realized among these social and healthcare professionals in public healthcare, the nurses and public health nurses were the biggest group. And it shows really that we need a strategy for nurses in that sense. Well, we're building the strategy. As you saw in earlier slides, that the citizens are expecting digital services also in the healthcare, and also our environment infrastructure is built so that it supports new services. And we want to enhance citizens' participation. And the first Finnish Nurses Association's eHealth strategy for nurses was done 2015, and I think it was a little bit too early, and at that time we wanted to increase the national debate on the role of nurses in developing and running digital services, and then after 5 years I think we are in the right time with our strategy, and Finnish Nurse Association, which with them we made the strategy. We were 11 experts from education, practice, and healthcare and development areas. And the name was now Digital Social and Healthcare Services Strategy. In Finland, both social and healthcare, they are really working in collaboration and have a strong liaison. And that's why we have also the social word here, but social field is around at the moment 10 years behind healthcare services, but it is developing fast. And here you can see the front page of the strategy, and here's also the web-based address where you can get the strategy. So we have the new strategy for digital health and social services consists of 6 different areas. And the strategy supports the participation of clients. We call them clients, which includes patients and customers, but we call it client in our strategy. And also, what is the role in decision making where people can be involved. And also the strategy want to support joint decision making between a nurse and a client. And the first area is the digitalization supports clients' participation, and it was we wanted to have it in the first because we feel that it's so important to emphasize the role of the patient or client. And we want them to be active part in the care. And the second area is digital health and social services as part of nurses' work. And the range of digital services is expanding, increasing the opportunities to support health and well-being. And actually, it is not enough that nurses have skills to use digital services. They need to support clients in using these services and use them in their care. And also, nurses can recognize potential, how clients can benefit digital services, because today we want to target services that are based on your special needs, and when it's targeted to you, then you are usually more active because you feel that your issues are the most important. And the third one is the ethical issues and security issues, which is very important today. And the nurse's ethical competence is based on value choices and involves the ability to act ethically, to recognize what is morally good and correct and what is maybe wrong. And I think the understanding the risks related, for example, to social media is important. If you are there representing your organization, or your work, or are you a private person, you must understand the difference between those options. And we must obey legislation and ethical guidelines. And quite many have done ethical approach to digital services. Different groups have done their own because it's important. And of course, it is ethical that we rely also what patient is providing the information and so and check it. And also we are advocate if the patient or client doesn't know how to use the services. So the fourth area, digital services and skills. I have been involved in nursing education in postgraduate level, developing master in digital health education. And in bachelor level in Finland, we have kind of national core competencies for nursing. And one part is linked in digitalization, information technology in bachelor level. But we also have from bachelor to doctoral level education, and it is connected to digital health, widely speaking. So it is important that nurses are active and motivated to use different digital health services and applications and reporting tools. And we had a nationwide project called Social Pedia 24/7, and it means that there were 24 higher education institutes and a lot of organizations around the healthcare, and they defined 12 digital competencies which professionals should have, starting from ICT basic competencies and interprofessional work in developing communities and online guiding competencies. So they are now defined and they are adapted to our nurse education as well. So the fifth one is digital social and healthcare services and management. And I think that the nurse managers play a key role when developing healthcare services and the skills of the staff as well. And therefore the managers are expected to understand how digital services can increase people's involvement in their own care. And services can be accessible to all regardless of where they live. And furthermore, nurses need resources and time to learn and practice the use of digital services and applications. And their competencies should be evaluated and widened along the new novel solutions and applications which come often. And also the well-being of nurses is crucial. During this pandemic especially, it has been, in Finland we have a strike among nurses at the moment, and one is that they want to have better working conditions and more salary as well. So the nurse managers are now in a very important position and role, and they must ensure that the staff skills are utilized in developing of digital services, and when they are involved, they are committed to do this work and have more resources. So the research and development is, I think as a researcher, I think it's important because the digitalization is a process of transforming practices, internal processes and services through the use of technology. And research in all phases is important and helps develop and understand new solutions when new technologies emerge. And it's important to publish nurse-led studies. And I really value that Claudia Butts has done this and has been following up studies related to telenursing or digital nursing. And also when you study, you can share your experience and that is important. And I think that the nurses should participate both in national and international networks and share their research and good practice and use knowledge generated by others to develop their work. And we accept this evidence-based nursing practices, which is important too. And via digital tools, it's also easy to share information like we are doing here now. So putting the strategy in the nursing practice. So we have want to have Finnish Nurse Association has been the organization which has made this possible to make this strategy, and I'm convinced that after 5 years we have a new strategy as well, and it is shared by Finnish Nurse Association's web pages. So and nurses can give feedback. There's an area where you can give feedback at the content of this strategy, and also we are following that the nurse educators use this strategy and it penetrates the curriculum. So I think if at the end, I think nurses need sufficient digital skills, how to use it in their work, and also nurses play a key role in promoting digital health services. So thank you for your attention, and after this presentation, maybe we have discussion around this, our strategy. Thank you.
Thank you, Pirkko. Yes, hold your questions till we get toward the end. If you want to put a question in the chat box, that would be fine. I can monitor those as the speakers are continuing. A little advertisement between speakers. I welcomed everyone at the start of this session, but I see that more have joined us, so you're all very welcome. If you happen not to be a nurse member of the ISfTEH, please do join. We'll talk a little bit about that at the end as well. There is no cost for nurses or midwives to belong to the organization, so it's a rare opportunity for you. So our next speaker will be Kerryn McGowran from England. Kerryn McGowran, rather, from England. And I turn the talk over to you, Kerryn.
Thank you. Thanks so much, Claudia. And nice to see everybody today. And as Claudia said, I'm in sunny London, as you could believe it. But today I'll be talking to you very much about our company and our medical team, which largely features a lot of nurses actually who work in an international healthcare setting. So what I'll do is just run through a little bit about who we are as a company, what our services are, because we're using telehealth the whole way through. It threads through everything that we do because all of our clients and members are in international locations. And then I'll talk about how we've used telehealth in a really challenging environment and really austere environments actually throughout the pandemic and beyond, and to finish off with a little case study at the end. So my background is emergency medicine, trained in Australia, and then I came to sunny England, gosh, 23 years ago, and worked in some of the major trauma units in the UK, and then came to International SOS about 16 years ago. So really delighted and thanks for the opportunity to share a little bit about what we do as a company today. So SOS as a whole, we're a really large organisation. We're medical and security services combined. And what we do is we work on behalf of really big international and multinational clients and generally look after their expatriates or their business travellers. And now more and more in the pandemic, we also look after sort of local assignees or local nationals as well. So we work on behalf of these big multinational companies to give medical assistance and advice to their members when they need it in different locations. So examples of clients we have would be sort of big oil and gas companies, or it could be government, non-government, humanitarian, hotel chains, tech companies, the list goes on. So really big organizations, and they send their employees all over the place. And when they get sick by accident, injury, or anything, they call us, and then we assist them remotely using telehealth solutions. So with what we do as well, we've got a really big people network. We've got about 12,000 employees, and well over half of those are medical professionals. And I'd wager that well over half again are nurses. So we're hiring more and more nurses as days go by, because we work a little bit the same as you would in an emergency department, where you're a team of medical professionals, nursing, doctors, and also, logistics experts as well. So you work in this kind of collaborative environment, and everything we do is by phone or by different telehealth solutions. So you've got that really great global outreach. So in the course of the day, you could speak to somebody in London, in Mozambique, you could speak to somebody in Beijing and Sakhalin, and so on. So it's quite interesting, in terms of communications and outreach. And a pretty big phone bill. We make over 4 million calls a year to our clients and members. So definitely big on the communication side of things. Just a little bit about how we're structured just gives a bit more context to the case studies I'll share later. Most of the work that we do is from what's called an assistance centre, which is what it says, it's giving assistance. And we've got 27 of these locations globally. So I'm in the London office today, but I support the nurses right across the region in offices in Johannesburg, in Dubai, Frankfurt, Paris, and also Madrid was one of our new ones. But we've got that replicated globally, so that in 27 sort of key business hubs, we've got these assistance centres that are staffed with a full medical, security and operational team, so that when our clients and members call in, we're able to immediately speak to them, triage the call, and then help them, to whatever, requirement that they have. And these assistance centres are basically like a hub for a region. So here in London, we look after all of Scandinavia, the UK, the Netherlands, whereas across the way in Paris, they look after West Africa, which has got a whole different kind of set of challenges. In Scandinavia, sometimes in the wintertime in Greenland, for example, moving somebody out of there is quite difficult logistically. And then obviously our colleagues in Paris look after sort of West African speaking, French speaking areas in West Africa. Beijing look after China, so they speak the language there, and so on. So you see all these different centres then work closely together as this big kind of hive mind, I suppose, that have different levels of expertise and knowledge in depth about Medivac, standards of care, the healthcare needs of those regions that they cover. So, for example, if one of our patients became unwell in Beijing, I could call the office there, they would get a medical report in Chinese, report back to me in English, and then I could update the client and the member that way. And our team would then communicate with the local hospitals so that they would really understand what's happening to that patient. Are they safe to stay there, and so forth. So really kind of quite complex, I suppose, on the surface, but it means that we're very well connected, and no stone is left unturned in terms of what we offer to our clients. We also have 64 clinics, which again are very much built and staffed by local and international staff in different areas where perhaps the healthcare might be a little more variable. So we build our own clinics to support client projects. So think like a big oil and gas company might set up camp in a particular region in Asia, for example, and then we will then build a clinic to support their population from an eHealth point of view, emergency service point of view, and so forth. And some of them you can just stabilize somebody overnight there. So intubated, ventilated overnight, versus, then they get Medivac to a more definitive point of care afterwards. So again, these 64 locations are dotted around the world. And then we look after also a lot of offshore installations and vessels as well. So quite a big organization. And as I said, it's very medically driven, and also a very big focus on security, so making sure that our security consultants go out and support clients as they move to different areas as well. So a big, busy organization, and certainly brilliant to work on an international scale. In terms of languages, we've got, I think about 99 languages spoken within the company, and even in our London office, there's 56 different languages just here. I contribute nothing other than my Australian English origins, but one of my colleagues, I was just having a chat to, one of the doctors, he speaks 5 languages fluently. So it really is this amazing sort of multicultural network, which then if patients call us in by phone, you've got somebody who knows the language, understands the healthcare and so forth, and can really support them that way. In terms of the nursing team, so we work with doctors, as I said, but also from a nursing perspective, we do a really broad scope of role. Predominantly it's office-based, so you're managing patients' care over the phone, and you're largely office-based, but a lot of our teams still work clinically as well, because they might go back to the NHS, for example, or their local healthcare structure, so that they can keep up to date with hands-on clinical skills. So there's a picture of Ondine there, all suited up in the height of the pandemic, where she was back in ITU for a couple of months. We do a lot of event support for clients as well. And then often, as things are picking up now on the commercial airline market, we're able to do nurse escorted missions and transfer patients back home. A little more difficult to do that in the pandemic because there just wasn't the availability of aircraft, as we all know. And I'll cover that a little bit in my presentation shortly. And then, yeah, we've got medical rooms in each centre, and all of the nurses across the region are hired and trained and work in very much of a similar way, and very much that corporate level of service that we offer to our members throughout the world. The backgrounds of the nurses as such, emergency nursing and intensive care, pretty much everyone is either ED or ITU trained, but also lots of the team have experience working in cruise ships or military or humanitarian sectors, and that international mindset of people who've got a real passion for global health, public health, and so forth. So just to give you context of the sorts of people that would be potentially answering the phone when patients call in. So just quickly whiz through some of the services that we offer. So for example, if I keep saying a member, but it's basically a patient, it's a code word for patients, and it's somebody who subscribes to our service here. People would call us in if they were about to travel, so they're pre-trip, so they'll call in and say, look, I have not traveled for 2 years because of the pandemic. Now I'm about to go on business travel, and I'm going to go to 5 different countries in Africa. What do I need to know about my vaccinations? You think, gosh, well, where do we start with that? So we have to sort of do almost like a consultation to understand what their vaccination history is like, look at where we can refer them to get good care and to get their vaccination regime on track, talk to them about the risks that they may find at that location, and really support them so that when they do then deploy to these locations, they are mission ready, and they're able to work and do their job to the best of their ability. Also in the pandemic, in the pre-pandemic world, we used to look after patients who mostly were going to high-risk locations, but since the pandemic, we have people calling us pre-trip for any travel. Now, I'm a London businessman and I'm going to Frankfurt for travel. What do I need to do? What do I need to be aware of? Because the world is so different, now as it was before. So really interesting and a big kind of travel medicine focused pre-trip. Generally then, in terms of medical advice, patients will call us from every location you can imagine. So really varied calls. So each time the phone rings, it's a different patient in a different location, a different request for assistance, and a different client or type of organization that we work on. So your medical assessment skills need to be pretty on par, because you've got to be able to think about if someone calls in with a child with a fever, it's very different how you'd risk assess someone in London who had not traveled or left the UK versus a child with a fever in Mozambique, for example, where you might be worried about malaria and endemic health risks there. So your assessment of that patient over the phone by triage will vary depending on location and clinical need. So definitely not a boring day out working here. We also give referrals to patients. So somebody might call in, and after we triage and speak to them and understand their condition, we'd then refer them for care. So rather than somebody just Googling up a storm and thinking, oh, that place looks nice, I'll go there, we actually give a verified, quality assured referral for where we know, and one of our team have actually been out and assessed the provider, and we can send somebody to get care there. So really, good governance around where we're sending people to. If somebody is admitted to a hospital, so an accident, an illness, etc., we will then speak to the patient, the treating doctor, the nurses, and the client the whole way through that period of hospitalization, because what we're wanting to know is, are they getting the best care locally? We benchmark that against international standards. We think about, at some point, most likely that patient's going to need to get back home, and are we comfortable for them to stay there, or do we need to medevac them out because perhaps the standards of care aren't up to scratch in terms of what they need for their particular condition. So again, it's that kind of governance around, should they stay or should they go in terms of their medical care. And then if we need to medevac somebody, then we either work with a really large fleet of air ambulances to transfer somebody home, or we will send one of our nurses or doctors on the flight to medically escort them home on more of a commercial airline. So, British Airways or, Qantas or something like that, we would be using our own team to do those medevacs and transfers. Again, in the pandemic, a little bit tricky to do that. So we had a lot more air ambulance moves than before because there just wasn't the availability of aircraft. So all in all, it shows, I think, hopefully the broad scope of services that we're doing and all the ways that nurses work within the organisation using telehealth. We've got loads of resources. We've got these amazing sort of maps and databases that we've built as an organisation that somebody might call me from Burkina Faso. I have never been there. I would love to go there, but I've not been there. How do I know what the standards of care are like and how I could refer someone to see a GP? Someone's done all that for me. My colleagues in Paris will have checked it out, and we can just tap into these databases behind the map, and it will give us, again, evidence-based referrals and advice and guidance around what the standards of care are like. So it's kind of like traveling from your armchair is how I like to think about it. So in the pandemic, we didn't move, but we felt like we were traveling because we were still communicating and networking with people from all around the world. Telehealth as a whole, I mean, we use all of these different aspects of telehealth in our day-to-day roles. So, lots around telediagnostics, teleassistance, teleconsult. So our organisation as a whole uses all of those, but I thought for the sake of today, I would just perhaps focus on one because I appreciate its time is short. And I thought what I'd do is just talk you through how we use specialist telemedical consultations throughout the pandemic, and actually we were using that kind of setup before the pandemic, but then how it changed and then what we're seeing as the future. So I thought I might share a case study on that with you now. So this map represents the British Overseas Territories, which is 14 territories that have a constitutional and a historical link to the UK. So as you can see, really remote kind of islands and really interesting places, again, which I'd love to go and check out properly. Places like, Bermuda, St. Helena, Ascension, Tristan da Cunha Island. So really remote. I mean, there's not much around there really in terms of, larger infrastructure, and also quite challenging normally to sort of fly in and fly out on a scheduled aircraft. So with these, really remote, austere environments, often they have very small medical clinics, very limited, medical and certainly very limited specialist consults. So normally if someone became unwell and needed a specialist review, we moved them off. They would move off the island and they would go back to their home countries for care. In the particular clients that we were working with in these areas in the pandemic asked us to look for a solution where they were worried about what would happen if COVID ravaged through those islands. So what we started to do for them was to build up, we knew the pandemic was coming, they were worried about COVID impact. So we recognized that there was likely to be an increase in respiratory issues. So they wanted us initially just to look for respiratory and cardiac and perhaps, like a general kind of physician, internal medicine specialist. That if a doctor...
Can you begin to summarize? Your time
Oh, yep, sure. So this solution we put together, and then what we did was when the doctors on the islands found somebody who was unwell, they would then refer those, somebody would call into the assistance centre, a nurse or doctor would speak to them, triage them, assess them, and then we decide what sort of specialist consult that they would need. So for example, COVID didn't impact the islands as they thought, because obviously they were small, they were remote. So actually what did mitigate was that the need was much greater around pediatrics and sort of general surgery, orthopedic, all of those other illnesses which didn't stop just because of COVID. So what we managed to do was make this digital solution where, they'd call in, get triaged. We then get them a specialist consult remotely, and then they were able to give CME to the doctors locally. So they learnt by working with specialists, and people were able to stay in these locations, which were very difficult to get off for much longer to maximize their care and their outcome. So very, very briefly, there was a case of a lady who they query needed a lung transplant because they thought she had, she did have sort of end-stage lung fibrosis. We're quite worried that she might need a transplant, but actually by having this specialist reach back service, she saw a respiratory physician who was based in the UK that was organised and managed by the medical team. They did serial CT scans. They had a review by thoracic radiologists looking at echoes and ECGs and cardiologists. And actually what they found was that it was a brand new diagnosis of non-specific interstitial pneumonitis. And what she definitely didn't need the lung transplant, but she did need care care and support and advice around lifestyle and optimal medication with the right types of steroids. So in summary, by having this specialist reach back service miles and miles away from where she was stationed, it negated the need for her to be medevaced off this small island in the height of a pandemic where she probably wouldn't have been able to fly anyway. So apologies if I've gone a little bit over, and I will hand back to Claudia and take any questions later on. Thank you.
Thank you, Kerryn. That I just find International SOS so interesting, and I have to give a shout out to that organization because in spring of 2021, I think, we published our impact of COVID on nurses and midwives monograph, and International SOS was key in helping us make that a beautiful publication. So thank you, Kerryn, and thank you, International SOS.
Thanks, Heather.
Okay, our third presentation will be a dual pair, or two people, I think, from Nigeria, and I'll let them introduce themselves quickly and we'll get started. I think, Dame, are you starting? And we'll go from there.
Thank you. Hello, everyone. Yeah, standing on the existing protocols, we are presenting on building Nigeria's telenursing ecosystem, opportunities, and challenges. And this presentation is prepared by a team from Ayinla, Nigeria, and the Kerryn Digital Health Hub. And I'm currently the Chief Executive Officer of Ayinla, Nigeria, Institute of Nursing Research in Nigeria, and I double as a PhD candidate at Chinese University of Hong Kong. This is our table of content. Objectives: we want to examine the present state of telenursing in Nigeria, and to discuss the state of telenursing research in Nigeria, and to explore the challenges and opportunities of telenursing. I hand over to my colleague to start.
Thank you very much. Yeah, now we'll just do a brief introduction. Now we have about what telenursing is in a broader sense. And now, right now in Nigeria, telenursing is actually evolving. It's a new concept in Nigeria and basically Africa. But right now we are seeing more nurses, more healthcare professionals understanding what telehealth is. And nurses are already using their mobile phones, mobile device, web platforms to provide care to patients in areas of health education, health advice, especially in maternal health, in chronic disease management, diabetes, and hypertension. And now from reports, we are seeing that more Nigerians are using mobile devices and more are being connected to the internet. Next slide. Now, the COVID-19 actually made telenursing or telehealth or telemedicine popular. Prior to the pandemic, most people didn't know much about what telenursing is, but the pandemic came and opened up opportunities to startups, to companies, to organizations to know that, oh, we need to pay more attention to telehealth. We need to invest more in this area of healthcare. And now in Nigeria, we have about 200 million people. That's a very large population. And about 60% of them are young. And that means they are connected to the internet. That's a very good opportunity for the ecosystem in Nigeria. Next slide, please. Now, in Nigeria and Africa, as we all know, it's a new concept. Much hasn't really been done in the area of telenursing, though rudimentary, but it's something that we can pay close attention to. Next slide. Now, basically, in Nigeria, what we have been doing in the area of telenursing is divided into these three major classes. Now, the first part there is interactive telenursing activities. The first speakers have said something about it, but in Nigeria, it doesn't really have a strong structure. So there isn't any startup yet or any company that is providing these services. Instead, these services are just rendered directly from nurse to patient or from nurse to client, where a client calls a nurse at home and requires certain medical advice, certain healthcare information to them, and the nurse practically gives it to them. Now, the next part, which is actually in development stage, but it's actually doing very fine, is the area of digital literacy training for nurses and healthcare professionals. Right now, the only startup in Nigeria doing this is Pirkko Digital Health Hub. a hub which we founded in the year 2019 with the sole aim of building a community of nurses and healthcare professionals who understand what the digital era is and developing a working strategy for implementation that includes nurses in decision making. So what we want to do is that we want healthcare professionals and nurses in Nigeria to be involved in developing these telehealth solutions. We don't want it just to be for the engineers, the software guys, and all that. We want nurses who have clinical experience to be involved in creating these medical solutions. And the last part is administrative purposes, which is quite big in Nigeria here, where nurses have monthly meetings, monthly meetings where they do patient reviews. Next slide. Now, in Pirkko Digital Health Hub, last month we had a first of its kind digital health conference in Nigeria, where we brought various experts in the field of digital health who came together to share their experience. These are experts who have wide experience in the entrepreneurial and business aspects of digital health. They came to share their ideas, to share how they have created their own pathways in the area of telehealth in Nigeria. And in that conference, we had a lot of nurses showing interest, bringing up ideas, wanting to understand what telehealth is. And we followed that conference we are following that conference with a 90 days career transition bootcamp. Yes, in this bootcamp, we want nurses and healthcare professionals to get to work. So we want to expose them to the core skills that are needed to build these telehealth systems. We want them, like I said earlier, we want them to be involved. We want them to be in the core aspect of creating these technologies, of providing these solutions. And now I'll leave the floor to my colleague to continue in the aspect of research in Nigeria. Thank you.
Thank you very much for that. So I'll be taking on the Telenorsing research conducted so far in Nigeria, and a study conducted in the year 2018, and this study was published in the journal by this organization, and it was found that many people among the rural women, they perceived that mobile phones can be used even to render different care that they need maternally. And we also found that 91% of them possessed mobile phones, and this was 2018. This is now 2022, and the percentage of people that have mobile phones has actually increased over time. And also there was a positive perception about the use of eHealth. Also in 2017, a study was conducted among nurses, and this study found that 84.8% of the nurses were actually interested in the usage of telenursing for improving communication and collaboration between nurses. Also, this was 2017. The perception has actually improved over time. Yes, currently I'm a PhD candidate at the Chinese University of Hong Kong, and my research is telenursing focused. I was able to conduct a systematic review on the effect of eHealth interventions on psychological issues experienced by women diagnosed with breast cancer receiving chemotherapy. And from this review, I found that nurses were a majority of the people providing this intervention among this population. And we found that this intervention was able to address various psychological issues among this population. So I went ahead to also conduct a qualitative study to understand the perception of Nigerian women receiving chemotherapy for breast cancer as far as the usage of eHealth intervention to provide psychoeducational support is concerned. And I found interestingly that many of them were highly passionate about mobile phone usage, and they had been using their mobile phones to actually receive a lot of information, but it is not yet organized. So from this evidence I got, I've developed a mobile application called Semba, which is the ChemoNurse breast cancer application. And this application developed will be used to provide psychoeducational support for Nigerian women receiving breast cancer chemotherapy. And of course, we are going to be conducting a randomized control trial to test the effect of this intervention, which I'm currently on. And I also received a scholarship award to support these activities of being involved in telenursing. Challenges facing telenursing in Nigeria, one of it is unavailability of internet-driven facilities and weak internet connectivity. Also, we have a challenge with insufficient technical skills among nurses and healthcare professionals, and this is what Care Code Digital Hub is actually working on. Also, we have poor perception and trust in telenursing models, concerns about safety and user friendliness, and of course, we also have poor electricity supply. What are the problems telenursing can solve in Nigeria? An example is provision of healthcare services to underserved regions of the country. Like I said earlier on, that study conducted among rural populations, even in rural populations, they are already using mobile devices. So this can be leveraged upon. Also, it can reduce the cost of accessing healthcare. It can also tackle the nursing shortage plaguing the country currently, and it can also save time and increase efficiency on the part of the nurse, and it can also reduce stress by improving work-life balance, and reducing commutes. What are the opportunities for telenursing in Nigeria? As my colleague said, a young population, Nigeria has an innovative and young population, which can be leveraged on as far as providing telenursing services is concerned. And another is a thriving telehealth ecosystem and a widespread use of mobile and internet devices, and of course, a robust tech ecosystem. In conclusion, telenursing startups should be developed in Nigeria. Healthcare facilities should start teaching nurses and healthcare professionals about digital health. More investment is needed in telenursing in Nigeria, and nurse leaders should embrace telenursing and encourage their team members to do the same. These are our references. Thank you all for listening.
Thank you very much, Damilare and Daniel. Those were excellent presentations, and I'm so interested in your doctoral work. Dami, you've got a really good start on seeing what the needs and opportunities are in Nigeria for telehealth. I also want to thank our other panelists. We've had 3 really great, really different presentations. Pirkko talked about strategy, overall strategy, and Kerryn talked about actualization of telehealth in a huge international organization that serves people with healthcare needs. And then, of course, we have the Nigeria example where more and more progress is being made toward using mobile health applications for health, better health overall. So thank you all to our speakers. We've just had a few questions, and I'll pose those, and anyone who would like to respond from among the group, I welcome your response. One is, how can nurses do mental health, telemental health, we'll say. And I know from my reading, this is a really big topic, and there are many types of telemental health that are going on, from nurses, physicians, other providers. So panelists, any response to that about telemental health?
Actually, I wrote an answer while listening, and I think that, of course, I can speak only from Finnish side because I live here, and I think we have done a lot of options for mental health patients or clients with having those problems, so they can access even anonymously in some way, in some part, to get help. Young people have their own channel, and I think it's available 24/7 today. But I think that the pandemic has caused a lot of mental challenges because people are worried and they are separate, they are isolated, and it doesn't fit for all. And school children also, we were just seeing our news that there were quite a lot of health challenges in the mental health area. But I think that in our country, we have done a lot of course, we should do more, but anyhow, there are options and people know how to use them. And Finnish people love to be alone, but not feeling alone, loneliness.
I can relate to that, living in the country as I do. Right?
Yeah.
In Nigeria, mental health and telemental health, are you recognizing that and dealing with it in various ways?
Yes, mental health is actually a very important issue that we are looking into as far as telenursing is concerned. And one major theme that is now recurrent in Nigeria that people are now talking about is community mental health. Over time, mental health has been domiciled in institutions. So we are now looking into how to step down mental health care into the community. And telenursing has been identified as a means to now deliver mental health on a community health nursing basis. Actually, I'm a community health nursing specialist, and I'm passionate about rendering care to the community. And telenursing can actually be a means whereby we can step down mental health care to the community. Thank you.
Excellent. Yes. Kerryn, how about mental health issues in an international and mixed care recipient group?
Yes, definitely a big consideration, and a little bit like what Pirkko was saying, you know, the pandemic's put massive stresses and strains. I mean, in the height of the pandemic, we were seeing a lot of calls for people who were perhaps quarantined in locations where they're unfamiliar with, or in local quarantine facilities where perhaps they were, you know, worried or scared. Plus, obviously, the worry around, you know, COVID itself. You know, we have a lot of expats and business travelers, and with that, in these kind of remote environments, often that can manifest in different ways. And we have lots of sort of outreach wellness support services as well. So, you know, for example, now in China with the extended lockdown, you know, we're able to support clients by having like a well-being outreach call to different members to make sure that they're okay. So it's a huge agenda for us, and we have almost like a dedicated team that work on those mental health resilience side of things to adapt to what our clients are asking for in the locations.
Thank you. I know there's a very large need. It's certainly true in the US as well. And another question was about telehealth resources for quality. For example, are there any key documents, published studies, or textbooks that you found really helpful in terms of maybe getting started with telehealth or opening up new ideas about telehealth?
Well, I think in Finland we evaluate nearly annual basis what we have been doing, also in collaboration with Nordic countries, Sweden, Norway, Iceland, Denmark. But I think we have a lot of material how to evaluate, because we do a lot of collaboration. And I think even in the European Union area they have, but maybe not so thorough as we have it in Finland or in Nordic countries.
Mm-hmm. In Nigeria, are there can a nurse who is in, say, graduate education for a master's degree or working toward a doctorate, can a nurse focus on telehealth per se and complete the degree requirements with a focus on telehealth?
Yes, currently in Nigeria, we don't yet have telehealth or telenursing defined as a subspecialty that people can go to have maybe masters or maybe PhD in. But what people are doing currently in Nigeria is they are carving a niche for themselves in telenursing. And this is being done by different people from different fields. For example, one of my teachers, she was the one I referenced earlier on, Dr. Detola. She's a maternal health care specialist, and she was able to develop a telehealth strategy to render care for women that are receiving antenatal care. So that is our own part. I'm working on oncology. I'm doing my PhD in nursing currently. So I have also carved a niche for myself. As far as telenursing is concerned, I'm finding an intersection between community health nursing and oncology. So these are what is actually happening. But I believe over time, it's going to evolve into a state whereby we can now have a defined field of telenursing in the academic trajectory. Yeah.
Good. I would say in this area, telehealth and telenursing, I have found that we are not a degree producing item, unlike our say, sister specialty, which I think might be informatics nursing, which is more specified in terms of standards and so forth. I just pulled out an old presentation that I gave years ago about that, merging telehealth and informatics nursing. And I may get at that again, because I think there's value on both sides, but we're like two separate camps, if you will, the informatics nurses and the telehealth nurses. And I think that it would be really good if we could merge and collaborate with each other and generate more effectiveness with a group or a bipartisan involvement. But that's for another time, I suppose. I had another question about interdisciplinary teams. Are people aware of, well, I would think in an International SOS, that would be the lodestar of interdisciplinary teams working to either evacuate a patient or decide what needs to be done for a particular patient care group. Do you want to speak to that, Kerryn?
Yes, sure. Just a practical application in terms of books. And I think when we speak to nurses, we look for ED, ITU nurses, but for them to think about that shift away from clinical environment into an office-based role, where I've had more busy, stressful days working here than I ever had in a triage, in a resus bay in central London, that's for sure. But there's sort of books called, one's called A Telephone Triage Protocol for Nurses by Julie Briggs. And it's a nice way to kind of get in. And then once you're in and you get exposed and you understand how to do the triage function of the calls, what our nurses need to do is think about, like I said, the medicine, but also the location and the standards of care that people might have. Put all of that together and then think about the risk versus benefit of somebody who might be very stable in a hospital environment on 2 liters of oxygen in, a hospital in sort of Central Europe. Then we're asking them to go at 35,000 feet in a small metal tube, hurdle, 8 to 12 hours across a couple of continents. And what's that risk versus benefit of flying? So again, the nurses are taught about aviation and, your oxygen requirements are going to double in flight. Is that safe to put somebody in? Would they need supplementary oxygen? And, working in a multidisciplinary team is essential for us. We've got the nurses and doctors working together. We also look at different things. Nurses are naturally good at that holistic management of a patient, aren't we? So looking at, functional ability, activities of day to day, but then we work with our clinicians, to decide who's best placed to do the transfer and actually get that patient in the plane and home safely.
All right, yeah, I can imagine all of that, really. Just had a quick question. Do you feel newly graduated nurses are more prepared for digital tech than those of us who are older? I don't know, we'll see. I certainly think in general, younger people are more comfortable with digital technology. I don't know if that's that carries over to the telehealth environment or not. Would be something to look at, I suppose. I would say too, in terms of interdisciplinary teams, one of the things about ISfTEH that I value a great deal is the interdisciplinary nature of all of our work. And when we still had conferences, which I hope we resume soon in person, that was a lot of the fun of it, was seeing other disciplines, working with other people in other disciplines who could contribute to either your issue or you could contribute to their issue. Is very, very open. So again, I would say a little advertisement. Now we have we had 48 people online, which I am so thankful for. And if you don't belong to ISfTEH, please do join. I had some inquiries about emails of the speakers too. People can contact me through the ISfTEH office, and we can talk about that. We're trying to be very careful with privacy and security, as you can imagine. So contact me through the ISfTEH Secretariat. You can find isfteh.org online and go from there. That's also where you would go to join the Telenursing Working Group. We're tentatively planning to have another webinar in September. We'd like to have a nurse midwife as one of our speakers, because we're trying to welcome nurse midwives into the Telenursing Working Group. Its membership is also free for midwives. If you're interested in making a presentation, contact me or watch your email. We'll publicize again the webinar and invite you to attend. And again, thank you to everyone. I think it's just on the hour, so we'll say goodbye. I thank again all the speakers. Excellent job, perfect timing. And I really appreciate everyone involved.
Thank you.
Thank you.
Bye-bye. Thank you.
Bye.
Yeah.
Bye.
Bye-bye.